Every week, young women message me saying, Auntie, I want to donate my egg, but I am scared. I don't really understand the process. If this is you, this video is for you. If you are thinking of becoming an egg donor in Nigeria, this video will save you from confusion and fear. Sit down. Most egg donors are not scared because they want to help another woman become a mother. They are scared because nobody explained things to them properly, and some hear scary stories and some hear half-truths. Some are rushed without knowing or understanding the process clearly. Fear usually comes from not knowing what to expect. Egg donation simply means a healthy woman help another woman by donating eggs she cannot produce. It does not mean you are giving away a child. It does not mean you will lose the child. And it does not mean you will lose your future fertility. Please take this clearly. It does not mean you are losing your future. This is where a lot of people are mixing it up. You are not going to lose your future fertility. In fact, if care is not taken, after donating your egg, there's possibility of you, if you have non-protected sex, there's possibility of you conceiving immediately, and it's going to be multiple because they are not going to pick all the follicles there. They are still going to leave some. And if you have unprotected sex, you don't get belly with that. Now, the next thing in your mind is, how am I going to be sure that I'm okay to go ahead with this procedure? The first step in egg donation is filling an application form and being screened. The first step is very, very important, and it is mainly to protect the egg donors, which is you. Most clinics in Nigeria look for egg donors between the age of 19 and 28 years old. The age range is chosen because the hair quality usually better at this age, and in the process it is safer at this age also. You will also be asked about your medical history, including any serious illness, your previous surgeries, and or any genetic condition in your family. Is either your mother's side or your father's side. And after that, basic health checks are done to check if you're okay, such as blood group, genotype, serology, and all of those things. This usually include a blood test, hormone test, and infection test. Majority of clinic may also do what we call scan to check your ovary to see if your ovaries are okay enough to go ahead with it, and not to disqualify you unfairly, but to make sure egg donation is safer for you and successful for the intended parents. If you pass this stage, that means your body is healthy enough to continue with the process. So you will do medical tests and counseling. Medical tests, they will check your genotype, your blood group, your serologies, and all that. And counseling is important because egg donation should never be rushed. It is your life. You have freedom to ask whatever things you want to ask. Any hospitals you want to donate your egg and you ask, they refuse to tell you everything about egg donation. My dear, leave the hospitals and go to another hospitals. It is your life, man. You have right to ask. Of course, you ask a lot of questions for that matter, and they are supposed to answer you. Any hospitals you go, you ask questions, they refuse to give you the appropriate answer, my dear, move to another hospitals. Of course, you are going to be on, it all depends on hospital's protocol. You are going to be on daily injections for 8 to 14 days. It all depends on how your body is responding to that hormonal injection given to you. Most of the question I get from egg donors a lot. I get a lot of this question a lot. So it might also be the next question in your mind. So let's answer this together. Of course, like I said, you are going to be on injections, and after the injections, they are going to be monitoring you. It all depends on hospital protocol. Some hospitals do their scan every other day, just like three days. They scan you today, tomorrow you don't have scan, next tomorrow they scan you again. Why they are doing all of this is to be sure that the injection given to you or the medication given to you has effect on your ovaries. And after that, when they are satisfied to the number or the size of your ovaries and they want to remove it, they are not going to cut you off. Of course, they are going to retrieve the eggs, and the procedure is going to be done by the professionals. Yes, they'll put you on sleep. Let me put it that way. You sleep for just about a few minutes just for you not to feel pain while they are carrying out the procedures. And how they carry out the procedure is by the same way they put something inside your vagina to scan you, same way they are going to do the retrieval, just a little bit different. Yes, that thing probe that is being introduced into your vagina, a needle will be attached to it, and it's going to be through your vagina. They will retrieve the egg through your vagina by a needle, sterile needle. So another question is, will the child still look for me? Of course, the child cannot look for you because it is highly confidential. I believe any hospitals you are going to donate your give you a consent form, you are giving your consent to give your egg to another person that cannot use her egg anymore. The child, you might not know the child, or you cannot know the child in Africa here. Okay, the next question is, can I return back to my normal days activities after the egg donation? Of course, you can return back to your normal days activities after the egg donation. You just have to take some breaks from work for your body to fully recover back from the injection given to you, and you have to take some breaks, relax, and your body return back to its normal. So the next question is, can I have my child in future? Yes. And let me tell you this, nobody will tell you, but I have to tell you this: stay away from sex. So after this donation, you have to stay away. If you have unprotected sex, you don't click inside you, there's still going to remain some follicles, and those follicles are still there waiting, and once they see the sperm, they, you are pregnant. Of course, you can still have your child after the egg donation. My important warning for you is, never donate your egg without understanding the process. No matter what, don't donate your egg. Never allow pressure. Never skip counseling. Information protects you. Get enough information. Ask questions. Ask. They are not going to kill you. Ask. It is your right. If you are considering egg donation and you want clarity, not fear, subscribe to this YouTube channel. If you have any question, drop them in the comments below. I will answer them honestly. Till then, see you in my next video. Bye.